coronavirus pandemic, hospitals have cited alarming decreases in stroke patients, an indication that people may be delaying medical treatment for stroke symptoms. And hospitals have simultaneously reported an anecdotal surge in severe strokes among young and middle-aged people infected with COVID-19. Dr. Clinton Wright, National Institute of Neurological Disorders and Stroke, is joining us this morning with what all of us really need to know. Good morning, doctor.
Good morning.
Good to have you with us. So we have heard a little bit about some greater risks for blood clotting or a stroke during COVID-19. What should we know?
Yes, you're right. There have been reports that COVID-19 infection, SARS-CoV-2 infection may cause a tendency to form clots, which of course can affect a lot of different organs, the heart, the brain, and cause stroke. And there have been some reports that younger people who don't have traditional risk factors for stroke have presented with stroke, but it's really early and we don't really know for sure. So we need to do more research to understand these links.
So, doctor, what would you tell people who are watching right now if they do experience symptoms of a stroke in the future, are reluctant to go into the hospital? What advice would you give to them?
I would say dial 911 and get emergency care as quickly as possible, because there's treatments that can be given to stroke patients that can only be given if people arrive to the hospital in time. There's clot-busting drugs, there's devices to pull clots out of large vessels in the brain if that's the problem and cause of the stroke. And only that can happen early on after stroke symptoms occur. We want people to recognize, most importantly, the symptoms of stroke. So we use an acronym called FAST to help people remember that. So the F stands for face. So if you have face weakness on one side that starts suddenly, the A stands for arm. So if you have somebody lift up their arms and one arm is lower than the other, they can't seem to lift it all the way and it seems weak, and that starts suddenly. The S stands for speech. So slurred speech, or the inability to understand what people are saying suddenly, or the inability to get the words out suddenly. That's another symptom. A couple of other ones include trouble walking, balance problems, loss of vision in one eye or double vision. And then the last letter in the acronym FAST is T, which stands for time, and the importance of getting to the hospital quickly.
And really quickly, doctor, what is the NIH doing to better understand the relationship between COVID-19 and the brain, and what are some of the effects when it comes to that?
Well, the NIH is supporting research across the United States to understand these links. Of course, in the middle of a pandemic, it's hard to do research because we don't want to expose healthcare workers and research workers to any added risk of catching the coronavirus. But the reality is we don't see a dramatic increase of people in healthcare settings getting infected, either people who seek care or people that are taking care of patients, because of the personal protective equipment that has now become standard at healthcare facilities around the United States. So I think the important thing is that we do as much research as we can to understand these links. The National Institutes of Health has started up a number of programs to create databases and to mine the emergency medical and healthcare record to be able to understand what these links may be. But we need a lot more research to understand the links before we can say anything definitive. One thing that's clear is that the number of people that are seeking stroke care has declined dramatically since the pandemic started, and we don't think those strokes are going away. Remember, almost 1 million people are affected with stroke in the United States every year. So it's a big problem. And if more strokes are happening because of COVID infection, then we certainly need to get those treated.
Well, doctor, thank you for all the research that you are doing. Certainly vital information for all of us.
Thank you very much for having me and getting the word out during Stroke Awareness Month. We have information on the stroke.nih.gov website for people to learn more about stroke if they would like to look that up.
And important for all of us to be aware of. Doctor, again, thank you and stay safe.
You too. Thank you so much.
You're watching The Morning Blend. We'll be right back.